Hello. Today I will show you ultrasound findings of post-procedural bleeding after FNA, which is essential for diagnosing thyroid nodules and neck masses, and after CNB, which is occasionally helpful. There is a nodule in the right thyroid lobe that is suspicious for malignancy. These are images obtained during and after FNA. How do these images differ from the pre-FNA image? Compared with the first image, a newly developed hypoechoic lesion due to hemorrhage is seen. FNA was requested for a right thyroid nodule. These are post-FNA images. A considerable amount of hemorrhage is seen posterior to the thyroid gland. A small malignant thyroid nodule in the right lobe was suspected, and CNB was performed at an outside clinic. The notch of the core needle is visible. In the last image, hemorrhage is seen posterior to the thyroid. In subsequent images, hemorrhage is still visible. 1 week later, on follow-up examination at our institution, the hemorrhage is no longer seen. When performing FNA, care must be taken not to injure an artery. The superior thyroid artery runs along the anterior aspect of the thyroid, and the inferior thyroid artery runs posteriorly. If the superior thyroid artery is injured, a hematoma can be seen in the anterior region, and if the posteriorly located inferior thyroid artery is injured, a hematoma can be seen at the posterior aspect of the thyroid. Since most cases resolve without significant problems as long as we recognize the presence of bleeding and achieve adequate compression, it is important to detect whether bleeding has occurred. After FNA of the thyroid nodule, a newly developed soft tissue density appeared just lateral to the adjacent carotid artery. In the upper case, there is a pathologic lymph node beside the carotid artery, and after FNA, a soft tissue density is seen around the carotid artery. In the lower case, a soft tissue density almost encircling the carotid artery is observed. This represents a subendothelial hematoma, and if the needle was located near the carotid artery during the procedure, you must always check the carotid artery afterward to ensure that there is no abnormality. Again, most cases resolve without significant problems if adequate compression is achieved, so it is crucial to determine whether bleeding has occurred. Thank you.